The Spoonful of Strength podcast is now the Spoonful Show. This podcast brings strength, humor, and heart to the chronic illness community. Inspired by the spoon theory, which shows us that even with fewer spoons, we can still live fully. This show highlights real spoony topics and practical insights to help you feel less alone and more empowered. I'm your host, Rachel, and together we'll take on this journey one spoon at a time. Hi, friends, and welcome back to the Spoonful Show. I want to start by saying if my voice sounds a little rough today, I'm fighting off being sick and my voice is doing its own thing right now. So thank you in advance for sticking through this with me. I actually did the interview before I got sick, so at least most of the episode, you don't have to hear me sounding a little raspy. Today's episode is a really special one, and I want to share a little bit of context before we jump in. I'm joined today by Michelle Sherman, a licensed clinical psychologist whose work is primarily focused on supporting families who are loving someone with a mental illness. As we were preparing for this conversation, we realized something important. Many of the challenges, emotions, and communication struggles she sees in families show up just as strongly in lives of people with chronic illness as well as mental illness. So this episode became a collaborative effort. While looking at illness, not just from the outside, but from both sides, the person living it and the person who loved them. Whether you're someone managing an illness or someone who's felt misunderstood, unsupported, or even doubted by family, there's something here for you. I'm really grateful for Michelle's insight and openness in reshaping this conversation, and I hope it helps you feel a little bit more seen, a little more understood, and a little less alone. Michelle Sherman is a licensed clinical psychologist, author, and professor who has dedicated her career to helping families navigate the challenges of mental illness and trauma. She's a fellow of the American Psychological Association, board certified in couple and family psychology, and was named Family Psychologist of the Year in 2022. Dr. Sherman has authored over 75 peer-reviewed articles and numerous books, including her latest, Loving Someone with a Mental Illness or History of Trauma, Skills, Hope, and Strength for Your Journey. Her work blends research-based strategies with deep compassion for families who often feel unseen and unheard. It's my pleasure to introduce Dr. Michelle Sherman to the show. How are you doing today?
Good morning. I'm doing well. Thank you. I'm very happy to be with you on this Friday morning. Thank you for that opportunity.
Well, to start the podcast, I would like for you to just start by introducing yourself to our listeners, personal, professional, anything to get this started.
Great. Well, as I said, I'm in Minnesota. Born and raised in Minnesota. I was away for 25 years doing schooling, and work. And as many Minnesotans do, I returned back. So I'm a licensed clinical psychologist. I'm board certified in couple and family psychology. That's kind of my area of expertise. I worked in the VA for about 17 years, so I have real passion for veterans and their families. And then I worked in a couple of medical schools, University of Minnesota, University of Oklahoma for a long time. So I've really dedicated my career to supporting families in which a member has a mental illness or PTSD. So while in the VA, I developed family education programs, and I've been writing books with my mom, which is kind of cool. She's a teacher advocate author for 20 years. We've been collaborating and writing books for families in which a member has a mental illness or PTSD. So in addition to my professional pursuits, I'm also editor of a journal. I do a lot of teaching and research and things like that. But in addition to that, I am a person who walks this journey every day. I have multiple family members managing mental illness, and it's an everyday thing. It is really challenging. And thus, I'm with you not only as a professional, but as a person with living experience, I would say, living experience. We've had a couple of suicides in my family. And so It is absolutely a very personal experience and passion. And thus, I volunteer a lot of my time to support organizations and talk to people. I'm on the board with NAMI. I do disaster mental health volunteer with the Red Cross. So I do a lot of volunteering to try to support these issues in my community and actually internationally. There's been cool interest internationally of other organizations interested in this topic. So that's who I am. And I have a puppy named Toby, and he is sleeping.
Oh my goodness.
But if we hear any little rustles or sneeze, it would be my puppy.
Oh my gosh. What kind of puppy?
He is a Bichon Poodle,
Oh my
Archie.
gosh.
Yes, he's
Very
sleeping
cute.
at my feet.
I've got my not so silent co-host with me. He's a basset hound, and
Oh,
he podcasts with me all the time, but lately he's been a little bit of a stinker. Yeah, been a little stinker. We talk a lot about mental illness in this podcast. We've covered it. As far as you working with families, could it be a crossover for people with chronic illness as well as mental illness?
oh, absolutely. There's a huge overlap. Absolutely. Living with chronic health problems is a huge risk factor, and there's higher rates of depression, anxiety, changes in relationship dynamics. I actually personally live with a chronic physical health problem, and so certainly relate at a, again, personal as well as professional level about the increased risks when our bodies aren't doing what we want them to do and the unpredictability. We don't know when we wake up one morning how our bodies, our minds going to be working. And so, absolutely that impact of chronic physical health problems and mental health problems. And it goes both ways, right? Because when our mental health is not as good, it affects our physical health. So they're intimately intertwined. Absolutely, Rachel.
Yeah, and I think this is a good topic to talk about because a lot of times being the one with the illness, you
Uh-huh.
don't realize
Yeah,
how it impacts families. And sometimes it can be really isolating. Like, I'm the only
absolutely.
one suffering here. I'm going through this.
Yep.
So, why is it so important to recognize that you're not the only one going through this, that it's actually affecting other people that love you?
Yeah, I think it's really hard because let's face it, when we're depressed, when we're in pain, by definition, we become focused on ourselves, on our pains, our deficits, our struggles. And so it's very easy, I think, to become a little bit self-absorbed and it's natural. And sometimes we don't look around and think about the ripple effects of our behavior on other people. And so it's like, oh, wow, I really have been more irritable or snappy lately. Or my partner says, you've been really distant or not engaged or kind of icy lately. And so sometimes it's like, oh, wow, I have some insight and awareness that I'm hurting the people I love the most, which I don't want to do. And so part of it to me as a couples therapist is helping people with communicating. It's like, hey, you know what, babe, I'm really hurting today. I'm really not available. I'm really struggling, whatever else. And so I have less to give to our relationship. And then my partner saying, oh, okay, appreciate it. I understand, Michelle. That sort of communication sort of stuff can help a lot because it absolutely can have ripple effects on relationships.
Yeah. What do you think are the most common emotional reactions that families experience when one of their loved ones is dealing with an illness?
Oh, that's such a great question. I think there are so many. I think there's certainly sadness and grief. This wasn't what I wanted for my loved one. Their physical pain, emotional pain. There can be loneliness of, my loved one is there, but not there. This isn't, they're not able to go to church with me or go and do activities or this sort of stuff, or they're not able to go because they're in bed or they're in pain because of the physical and or emotional pain. There can be certainly irritability and irritations like, come on, just do it. Just, come along and be with me. And so irritation at the illness. Some people get irritated, mad at a higher power. Why does my loved one have to have this experience? It's not fair.
Mhm.
There certainly can be powerlessness and helplessness. Like, what can I do? I want to help you feel better. I don't know what to do. We can go to all the doctors, all the experts, all the medications, and I can try to be your cheerleader. But ultimately, sometimes it's living with that. I can't fix you. I can't change you. I can't make this go away. And how incredibly hard and powerless that is, particularly with the up and down nature of many physical and mental health problems. Like some days they will be feeling great and up and ready, and some days they simply just can't. And so that can be super hard for families. So I think guilt, what did I do wrong? I am expecting too much. All sorts of feelings that families can go through. I think it can be really a roller coaster. And we know that caregivers in general are at higher risk for depression and anxiety and things. So it's all the feels, I would say.
Yeah. It's very relatable when you talk about how they may feel like they can't fix it. My husband and I were in therapy for many years, and that was something he kind of had to get through, is the fact that he couldn't fix it. And he tends to keep his emotions back a little bit and not communicate because he doesn't want to put it on me. And it's so frustrating, especially I think for men, of not being able to fix it.
It's huge. Men, parents, I work with a lot of parents of young people who have a mental illness and or a physical health problem. And it's like parents, men want to fix, want to change, want to make it go away. And so it's super powerless. Absolutely. Some of these things we don't have a cure yet for MS, for other mental illnesses. We don't have a cure at this point.
Yeah. Yeah. And I think that some people with the illness feel guilty.
Yeah,
Once they get past that, it's not all about me. They feel guilty about it impacting the family. So,
absolutely.
what's a good way to be able to acknowledge that guilt without carrying it as shame?
Yeah, no, that's huge. That's huge. I think as we can empower people with the illness to really work, although it's hard, to communicate and let their partner know, they can feel some relief of some of that shame, because it's like, I really do want to be present with you. I want to be involved and engaged when I'm feeling well, but sometimes when I'm not, I simply can't. And so realizing this is not, I don't want to, this is not, I don't love you, this is not, I want a divorce, this is like, I simply can't be present with you right now. And so that idea that we talk about of radical acceptance, right? Is like, I wish I felt better. I wish my body was working better today, but it's just not. And so instead of trying to fight it or change it or feel guilty about it, it's like, I have to accept this is where I'm at today. And I'm really hoping tomorrow is going to be a better day. And I'm doing what I can with my coping strategies, my exercises, my medication, my meditation, whatever else it is. But also, I just need to accept this is what my body and my mind are telling me right now. Nothing to be ashamed about. I just have to listen, communicate, and then express plan and intent to try to re-engage when I'm able to. It's hard though. It's hard.
On the flip side, what are some things that families can do as far as seeing like one day is better than the other, and that roller coaster? What are some things that families can do to support that individual?
Yeah. Well, I think there's a lot. I think part of it is learning about the illness and understanding that some things may be episodic, some things may be up and down. So it's not that your loved one is being, quotes, air quotes here, lazy or stubborn or whatever, fill in the blank. Okay, that family members come up with. It's like, no, this is part of the illness. Okay, this is part of what may be going on for them. So understand, and then try to communicate for sure and help understand. And then thirdly, I would absolutely say, I think it's extremely important for families to have their own activities, have their own people, friends, family. In the mental illness world, I really am an advocate of NAMI, the National Alliance on Mental Illness, where people can talk to other families who have similar experiences and can relate to it. Having your own, be it physical exercise, activity, clubs, sports, whatever it may be, but just realizing that there are going to be days that your loved one is not able to be present with you, which they want to. And it's like, what can you do for yourself at those times? Your own therapy. I talk to a lot of caregivers about their own therapy to take care of themselves as well, so they don't get depressed and down and real irritated at their loved one too. It's hard. It's really hard, but they don't have to do it alone.
Yeah. Yeah, I think that's important. In some families, family members struggle to understand or even believe that mental illness or chronic illness is real.
Uh-huh.
So, what do you find that's often behind that disbelief or lack of understanding, and how can somebody address that?
That's a great question. Yeah, I think about clients that I've seen in which they say, my mom, my dad doesn't believe I have depression or whatever else. And I think there can be lots of reasons. I think it certainly can be fear. What does that mean? I think it can be lack of understanding or education or awareness. It absolutely can also be cultural, spiritual, or religious beliefs. Okay, that they don't exist, that you're being tested by a god or higher power sort of stuff. So there are absolutely a lot of religious beliefs, a lot of cultural things that this is some spiritual sort of thing of that nature. And again, some cultures I absolutely want to respect their belief systems, but for them it can be more difficult. I also think about really horribly, some people, some particular groups have been used in the name of science in really inappropriate ways in terms of research and things like that. And so it's like, don't go to the Western system, don't go to that sort of stuff because they take advantage of people. And so all of that lack of trust due to what we as healthcare professionals have done, even horrible things like we used to, okay, that schizophrenia is caused by a schizophrenic mother, meaning cold, uninvolved, angry, over-involved sort of stuff. That's what we used to tell people. It's like your illness, you're hearing voices and seeing things and believing you have higher powers. This is due to the fact that your mom was a bad mom. I mean, with that, who would ever want,
Yeah.
to be involved and think about this sort of stuff? So there's a lot. Certainly, unfortunately, there continues to be some negative, inaccurate messages in the media about mental illness and what it is, and certainly portraying people with mental illness as violent. Most are not. Most are not violent, but it's like my loved one doesn't do this. They're not out doing X, Y, and Z, and so I think there are a lot of barriers to people thinking that their loved one has mental illness. Plus, much less oftentimes the person themselves may not think that they have an illness. There's a concept I just learned, honestly, and maybe you've heard of it. I didn't know about it until about a decade ago, in which the person with the illness doesn't believe they are sick. It's called anosognosia. Again, I've never heard of it. Anosognosia, but it is likely affecting probably about half of people with schizophrenia and maybe 40-50% of people with bipolar disorder. That's a lot of people. And it's not like they're in denial. It's not like they're just being stubborn or things. Just like people who have had maybe a stroke and have some paralysis, or people with dementia, some people with dementia, they simply don't think they have an illness. So if they don't, why would they go get help, right?
Right.
If I don't think that it's a problem that I'm seeing the FBI outside my front door, then why would I go get help? Okay, so it's a huge challenge for the person sometimes with the illness too, who doesn't think there's a problem. Lots of men stereotypically again can think, oh, I'm not depressed because I'm not crying, I'm not on the floor, but I'm irritable as a skunk and I'm
Yeah.
not sleeping, I'm not doing well at work. So mental illness can show up in lots of different ways.
Is there a difference between how men handle mental illness than women? You see, I feel like with men, it's they're good at hiding their feelings, they and all of that. Is it more difficult to help a man
That's a good
than
question. It's a good question. I actually don't find it more difficult to help them, but I think you're right. If you look at the rates of even help seeking, it's definitely more women than men, right?
yeah,
Some of our diagnoses, even, well, women get it more than men. Well, is it because women get it more than men, or women are more likely to come forward after it?
yeah,
And also, again, mental illness can look different in men versus women, sort of stuff. So, I think it's easier to say, oh, the primary care doctor says a patient comes in and she's crying and not sleeping, blah, blah. It's like, okay, depression, blah, blah, blah. If a man comes in and like, I'm irritable, I'm cranky, they may think, go to an anger management class or whatever else. They may not think it's actually depression. And so it can be missed by our healthcare providers too. But no, actually, once they get engaged in treatment, for me, and I think the research agrees, there's not a difference in terms of our ability to help them.
are you looking for merch that speaks to your truth and makes you laugh? Spoonful of Strength has you covered. literally. From t-shirts and hoodies to mugs and magnets, every design is made for the chronic illness community with heart, humor, and a whole lot of strength. Funny? Check. Inspirational? You bet. Illness specific? Absolutely. And the best part? I can personalize any design or create a custom shirt for you for no extra charge. So whether you're laughing through the pain or wearing your diagnosis with pride, our designs are funny, fierce, and illness specific, because being chronically ill doesn't mean being chronically boring. So if you want a sweatshirt that gets you, head to spoonfulofstrength.etsy.com. Now that's spoonful with 2 L's. Use code podcast for 20% off your entire cart. Going back to the last question, or the question before that. So if a mental health or chronic illness has caused strain within the family, what are some of the steps that the family can do to start rebuilding trust and closeness?
Yeah, it's a great question. I think there are a lot of options, actually. It may sound simple and obvious, but actually it's not. One of the main kind of couples therapists really talks about encouraging people to have regular, kind of what we call special time, in that they basically sit together and have time to reconnect about their relationship. How are things going? What's going well? What are our challenges? What are we wanting for our future? What's in the week ahead? Just having that regular commitment for a check-in, a relationship check-in. Some people do it once a week, perhaps after Sunday dinner. It doesn't really matter when, but just getting back on the routine of sitting down, looking at each other, no devices, but reconnecting what's going on can be helpful. There are absolutely self-help books written by people like John Gottman and things like that, that have really nice skills. There's also, I think, a real opportunity for things like couples therapy, in which people can come in together and have an expert on the outside really kind of look at, okay, I notice this is fictional. John and Mary, Mary, when you get really frustrated and hurt by John, you really become icy. You really shut him out. And then John, you really get irritated and you get more aggressive and things. And I just noticed this dynamic. Sometimes you can't tell looking at yourself. And so really being able to, oh, wow, have a professional help me observe my patterns and then help me, okay, I want to do it differently next time. So when I feel triggered, instead of getting icy, maybe I just want to take a second to breathe and say, you know what, when you said that, I really felt hurt, instead of attacking. So there are good things we can learn in couples therapy and books, and again, in reading and learning about the illness. Certainly doing enjoyable things together is a great thing for a relationship of all kinds. We haven't really talked yet about kids, but I certainly think families doing special things together, having rituals is very, very bonding. Sometimes, we do know that the illness can really impact the children as well. So perhaps encouraging the child or children to connect with a school counselor, or maybe there are support groups or things, or therapy for the kids as well. Not that they have to go like every week the rest of their lives, but they have someone who's really listening to their experience. In our country, sadly, there aren't a lot of resources for these children. And in the mental illness area, we do know that they are at higher risk for developing mental illness themselves. And so I'm a big believer in prevention. How can we connect kids with supports early so we can hopefully prevent them from developing some of the longer term illnesses? But yeah, special quality time, communication, learning about the illness, learning about relationship therapy. Some people find a great deal of meaning and purpose in spiritual connections, and reading or working through holy books, meeting with perhaps a clergy, all these sorts of things, I think can be really helpful.
I'm glad that you mentioned the kids aspect, because I'm sure that depending on the illness and the age of the children, I know with my kids were 8 to 12 when I was diagnosed with MS. And for a while, it didn't impact as much as it does now. And so anytime I get more progression, or maybe a test result that's coming back, I talk to them about it and try and have that open conversation of, is there anything you're worried about with me? and they're all boys, and so they always say no, it's fine. but but it is a good conversation to have because
Ah,
it does impact the kids.
absolutely. In that ongoing conversation. I love that. It's not a one and done, right? It's not a
Oh, no,
one
no.
time conversation.
Yeah.
It's important for it to be ongoing over time to continue to have the dialogue and be open for questions. They may not, when we're going to have a sit down and family meeting, they may shut down. They may say, no, it doesn't bother me. But then when you're driving them to soccer or before bed, that's a common time when kids want to talk.
Yeah.
And sometimes that's the time. So being open to hearing and sensing their feelings and what's going on, and role modeling, you're expressing your own emotions. And so, gosh, this is kind of scary. This is a tough day. And helping them, be able to learn how to practice identifying and sharing emotions. Lots of opportunities here. But I think helping the kids in developmentally appropriate ways understand what MS is, what it isn't, what depression is, what is it isn't. All these sorts of things I think can be extremely helpful. And kids these days, I think, have a little more awareness of mental health than we did back in our day. There is more talking about it. At the same time, I want to quickly add, sadly, a lot of the information is not accurate. There was a recent research study of actually TikTok videos about mental health and found that half of them had inaccurate information about mental health. So mental illness. So we need to be cautious and ask questions, what they're learning here and there and whatever else. So it's complicated.
Yeah. Yeah. For those that have a good dynamic within their family, but maybe friends, parents
Yeah.
are run into that, what sort of boundaries are healthy to be able to, I know with my family, beyond, in my household everything's good, but
Okay.
beyond that there are some issues, and I've had to kind of have some boundaries of really not sharing a lot of information.
Mhm.
And so for the individual who might have to set some boundaries, what are some good boundaries to do that?
Yeah, I think that's a great point. And I really believe, consistent kind of with the whole recovery movement, that it should be up to the person with the illness, what is shared and with whom. And that can change over time, right? In terms of
Yeah.
initial diagnosis versus maybe hospital admission or stability or things that can change over time. But I think it's really up to that person. What is appropriate, what is okay, what is not okay to share. Because let's face it, with some invisible illnesses or some mental illnesses, people respond in confusing, sometimes hurtful ways. And so I think it should be up to that person. At the same time, I think it's important for example, partners or things to be able to get support themselves. And so if the person with illness says, I don't want anyone saying anything, I think that can be hard for the partner and the children. So for them, have again either a minister or a therapist or support group where they can get some support themselves, because it can be a lonely journey for them as well. But yeah, I think families negotiate that, and we're back to this theme of communication. The person with the illness, letting them know and appreciating again, it may change over time in relationship and things. But absolutely, I think it's very healthy and appropriate to set boundaries. I also, um, at the same time, I don't want to think about increasing stigma, which is like, okay, it's a secret, don't say anything. Well, is that a message we want to give? This is something that our family should be ashamed of, or our family shouldn't tell people about. So, I absolutely empower and believe the individual with illness. It's their decision, and thinking about, is this something we need to have as a secret?
Yeah.
What are the cons? What are the downsides? Because when we keep things a secret, excuse me, it's harder for other people to support us.
Yeah.
So, it's tricky. I think that's an issue that can change over time, and really families can do well by communicating about it.
Yeah. It's so complicated. It
It
really
is.
is. Yeah.
Totally.
Yeah. So, what can help families better understand what their loved ones are experiencing, especially like with some chronic illnesses and mental illness, when the illness is invisible or unpredictable, even?
Yeah, yeah. I think listening, asking their loved one, checking in on them, being aware of warning signs, being aware of, um, yeah, just with physical illnesses, moving more slowly or not wanting to be involved or sleeping more. For some people, drinking more alcohol, being more irritable. It can be a lot of different things. But again, learning about the illness, talking, being open to feedback, asking questions, not in a critical sort of way, but hey, babe, how you doing today?
Yeah.
Could I go pick up the kids for us? Could I clean the kitchen, even though we're planning something room to do? How can we negotiate and be flexible about things? And so I think families can be the psychological term we use is attuned, meaning checked in. Not like hypervigilant. It's like, oh, every little movement I need to do something, but just tuned in to what's going on with my loved one. You can't read their minds, so you have to ask them and check in. But just, hey, how's it going today? And that's some of the check-ins I was talking about earlier. Can be really helpful for couples or families. Like, how are we doing? Excuse me. How are things going? Because we can't necessarily see, like with mental illness, a lab value. We can't necessarily see a level of depression on someone's body. So I need to tell you and look at your behavior and understand. So asking questions, being tuned in and perceptive, and keeping that line of communication open. Yeah. And then again, for families, when their loved one's not available, taking good care of themselves so they're not feeling really isolated and lonely too.
Yeah. Yeah. I agree. What are some ways that families can show compassion, but also protect their own mental health at
Mhm.
the same time? Because I know it can be difficult to be a caregiver
Uh,
and seeing this person that you love struggle and but also taking time out to care for themselves.
Yeah, it's a huge balance, isn't it? Yeah,
Mm,
exactly. It is such a great question because, yeah, absolutely. We want partners, even children in appropriate ways. I'm not saying make the kids be parents, right? But even little things like sending a text message, a funny meme, a post-it note, giving a hug, saying I love you. Uh, I love the dinner you made last night, Mom. That was really awesome. Thanks so much for going the extra mile and making my favorite dinner, whatever it was, expressing kindness, being affectionate, expressing pride in you. It's like, oh, Mom, gee, this is really hard for you to, or dad or partner, whatever else. I appreciate going to therapy, going to physical therapy, whatever else it is. It takes a lot. I really admire your commitment to yourself, to going to this maybe day treatment program or going and continuing to try to change your medications until we get a medication that can work. Just expressing a lot of empathy and care
mhm.
and how can I be present for you? Maybe you don't want to talk about the darn illness at all. I'm so sick and tired of talking about this. Let's talk
Yeah.
about something else. Maybe it's just going for a drive, and just being together, just being in the same space sort of stuff. But asking, hey, how can I be present for you? Expressing care, concern, doing special things together. Again, they don't need to be, we're going on a cruise to the Caribbean. It can just be, again, going to a special or favorite restaurant or bringing takeout and bringing it home and a special meal together. Rituals, as we were talking about, just connecting that family together as a team, and that we can do things not talking about the the illness. And then for the loved one, when they're feeling perhaps overwhelmed or a burden or like this is too much, this is too heavy, I'm getting depressed, for them to be able to set someone and say, hey, I love you, I care about you, and it's important, I need to go with my friends and go golfing today, or I need to do X, Y, and Z. And yeah, there may be a twinge of guilt in doing that sort of stuff, but if I don't do that, I'm not going to be actually as good for myself or as good for you. I mean, I teach caregivers things like it's okay to disappoint your loved ones sometimes. You're
Yeah.
not their doctor. You're not their therapist. It's important for you as families to be able to go and have your own activities in your own life for yourself and for your ability to be an effective caregiver. These are
Yeah.
easier said than done, but I think they're really important messages for families.
Hmm. Yeah. You've worked with so many families and patients throughout the years.
Yeah.
What gives you hope on how people can heal and grow together, even through a long-term illness?
Oh, yeah, absolutely. I've been seeing clients for about 30 years, so it has been a long time, and I've seen a lot. And I've seen the really, really hard times of repeated hospitalizations or crises or divorce or children being removed from the home. I mean, I've seen all the stuff, and it's incredibly painful. And I've seen families really show up in pretty remarkable, beautiful ways and learn ways of taking good care of themselves, taking good care of their loved one, of their children, um, even with the up and down part. I have people in my personal life, professional life, who it's like, wow, you're really doing it. And it gives me a lot of hope. The whole name of my company is Seeds of Hope, folks,
Yeah.
because I have a lot of hope. And I believe, obviously, there's so many new treatments and medications and therapies and things growing and developing. I just read there was a new FDA approved medication for Huntington's disease. There are lots of new things that are being developed, certainly for mental illness sort of stuff. So, absolutely having hope. And doesn't need to even be a big thing like, oh wow, a new medication's developed, but I hope, because I really see you continuing to try and continue to show up. And I'm so proud of you for continuing to show up and do the work of caring for yourself, caring for others, or even people like you who take your own life experience and help others. I mean, that's hope, right? That's amazing. You take your own life journey and pain, I'm sure, and difficulties, and use it as a conduit to help others. Oh, that gives me a lot of hope.
Thank you. That's so nice. I want to make sure that we can tell our listeners how they can follow your work, your website,
Yeah.
and your books. Tell us a little bit about where they can find you.
Yeah, great. Thank you. So our website is the best, and it's www.seeds with an S, seeds of hope books with an S.com, seedsofhopebooks.com. And yeah, our two most recent books are one for adults, published by Johns Hopkins University Press, called A Loving Someone with a Mental Illness or History of Trauma, Skills, Hope, and Strength for Your Journey. So that's for adults. And then we have one that I think is actually pretty unique. There are not many resources for teenagers, and it's called I'm Not Alone, a teen's guide to living with a parent who has a mental illness or history of trauma. Again, there are so few resources for these young people who we know are at risk and often feel very alone. So both of our books are highly interactive. They're not just like boring text. They're stories and questions and activities and uh, quotes from people who've lived the experience. And so I've taken what I've learned in my 30 years of clinical work and put it into kind of a book format that people can hopefully find accessible and helpful. So seedsofhopebooks.com. There are lots of free resources on that website too,
Yeah.
podcasts, articles, lots of free resources. So I would love you to share that on the show notes or whatever else you do to let people know about the website.
Yes, we will link it in all of our promos and we'll link it with the
Thank you, Rachel.
description of the podcast so that everybody can find that as well as your books. And this was such a collaborative effort of us coming together and really finding out what's going to work. And I really appreciate the fact of having somebody, for me, having somebody to really talk about the family part of it, because it really is not just a one person illness, and it really does um, involve everybody that you love. And I think this was a great topic to talk about. And I appreciate all of the great information that you gave. And it's so important to make sure that you're taking care of yourself, but also the family is taking care of themselves as well.
Absolutely. Rachel, thank you so much. I thought you and I did a lovely job of kind of melding
Yes.
interests, backgrounds, your listeners' interest. And I want to say thank you so much for this.
Oh,
It was really lovely to be with
oh,
you and talk about such important things. So it was delightful for me. And thank you for making it so lovely.
oh, thank you. That means a lot. And I just appreciate you so much. And this is going to be a good resource for our listeners. I
Good.
really believe it. Yeah.
Awesome.
As we wrap up today's episode, I hope this conversation reminded you that illness doesn't exist in isolation, and neither do you. So, whether you're navigating mental or chronic illness or trying to make sense of how it's affecting your family, your feelings are valid and you're allowed to take up space in those relationships. If something from today resonated with you, I'd love for you to share it with someone who might need it too, or even just sit with it for a moment and offer yourself a little bit of grace. Thank you for being here, for listening, and for saving some spoons to be with me today. Until next week, I'm Rachel from The Spoonful Show. Take care. Thank you for listening to The Spoonful Show. Follow the podcast so you never miss an episode. Leave a rating, review, and comment. Connect with me on Instagram at Spoonful of Strength and TikTok at spoonful.of.strength. Remember, that's spoonful with 2 L's. Shop customized t-shirts, sweatshirts, hoodies, mugs, and more on our Etsy shop at spoonfulofstrength.etsy.com and use code PODCAST for 20% off your entire cart.